Okay, I got the signal that we're ready. So Dr. Fullilove, Dr. Vora, if you'd like to take off your camera or turn on your camera, we'll be able to get ready. Hi, guys. And hello, everyone out there. Good evening. Welcome to Community Board 8's first program on contact tracing. I'm Alita Camp, chair of Community Board 8. We'd like to understand what tracing is, how it works, why we should all participate in contact tracing if we have been infected with COVID-19 or if we are called by a contact tracer. We want our lives to be able to return to the way they were. We want to be able to go to a restaurant, the movies, the theater, a ball game. We want to see our friends and families. We want to keep our jobs and have financial security. We want to enjoy all that the city has to offer, but we also want to be safe and healthy. The doctors tell us that testing and tracing is the key to being able to do all of those things because it will keep the virus contained as much as possible. There's a lot of information and many questions. I'd like to get started by introducing our moderator, Dr. Robert Fullilove. Dr. Fullilove is a professor of socio-medical sciences at the Columbia University Medical Center and Associate Dean for Community and Minority Affairs and co-director of the city's research group. He's written numerous articles in the area of minority health. Among his many achievements and recognitions, he was awarded an honorary doctorate from the Bank Street College of Education. We're lucky to have you with us, Dr. Fullilove. I'll turn the program over to you now, and thank you.
Thank you very much, ladies and gentlemen. It's a pleasure for me to be here. And for once, what gives me real joy is I'm not the featured speaker. It is my distinct pleasure to introduce Councilmember Levine, whose knowledge of public health and dynamics that we're confronting with this particular pandemic really give me pause for hope. Councilman Levine, we're all interested in hearing what you have to say. Take it away.
Well, thank you, Dr. Fullilove. It's an honor to share a program with you. I'm also really excited to be on the agenda with Dr. Vora, who's doing amazing work for us down at City Hall on this. I want to compliment Community Board 8 for shining a light on contact tracing, where we must build public understanding and buy-in in this program. And you're really setting the standard for community boards, which can and should be leading the way in convening conversations like this. So I'm just going to offer a few words on the big picture. At what I think we can all admit is a pretty challenging and complicated moment in our battle against this horrible virus. Because on the one hand, we're all sick of the pandemic. We're all sick of the lockdown. We're craving reconnection with our friends and family. We want to get out and socializing. We want the economy to restart so that people can return to work amidst a time of such economic suffering. But at the same time, this pandemic is not over. It's not over nationally, where today we marked a grim milestone. This was the single worst day in terms of number of new cases confirmed nationally, period, during the whole pandemic, even going back to March. We had over 38,000 cases confirmed nationally. And of course, all of you know that the virus is increasing, and at this point, I think 27 states. And we're hitting some really bad milestones in a subset of 7 or 8 or 9 of them. But this is not only a national problem. Yes, we're much better off in New York than we were relative to the hellish days of March and April. Most of the indicators are down 95%. But yesterday we had over 300 cases confirmed in the 5 boroughs. That's been typical now for several weeks. The virus is still a threat in New York City. And frankly, I don't think the public is taking it seriously enough. And often I hear debates among people who, on the one hand, they just want to reopen already for the economic reasons and all the human reasons that we've described. And they're facing off against people who want us to stay shut down. But those are not our only 2 options. We have a third way, which is a steady but measured march to reopening while building up the public health infrastructure that can contain the spread of the virus, that can suppress the spread of the virus. And the pillars to that are more testing, contact tracing, isolating, and quarantining. And contact tracing really is the central element that brings that all together, that makes that possible. And we need public engagement on all of this, public understanding, public buy-in, public outreach, on testing, where, you know, the good news is our capacity is probably 100 times. I'm actually not exaggerating. I think it's 100 times what it was in mid-March. And our bigger challenge now, while we continue to need to grow capacity, is we need the public going to get tested. And there's been a problem with building up demand for that. And we also need the public to participate in contact tracing. And Dr. Vora is going to talk you through this. But the bottom line is, if you test positive, you're going to get a call from a contact tracer. And we need you to take that call. And Dr. Vora will talk you through what that looks like. You also might get a call even if you haven't tested positive yet. How could that be? That is the core of contact tracing, which is going to identify people who are at risk because they've been exposed, because they work with someone who tested positive, because they were in a social setting, or perhaps live with someone who's tested positive. This is really the most important thing that contact tracing can do, which is can stop the chain of infection, even among people who might not know they have the virus, because we know that so many cases are asymptomatic, or in an even larger number of cases, people are contagious for a period of days before they start to get the fever and the cough. And so there are a larger group of people who are pre-symptomatic. We got to catch those people early, and we need those folks to be quarantining. We need folks who can't safely quarantine at home because they have vulnerable people in their family to isolate in hotels. And, you know, in neighborhoods like ours in Manhattan, where people have crowded apartments, it's particularly bad in my district, which is more on the west side and uptown. Dr. Fullilove is, of course, a resident there. We have crowded apartments. And, you know, I myself got coronavirus in late March, and I chair the health committee. I know all the rules. Still, though I did everything right, my wife got it. She actually had a worse case than me. We're all fine now, and we recovered. But it's tough to protect family. And so the city has a program of offering free hotels to people where you can go and isolate with food and some medical care. And Dr. Vora will talk us through that. And lastly, I'll mention about quarantining, which is, it's more than just sheltering at home. We've all been sheltering at home, except those of us who are the essential workers, the heroes. But for the rest of us, sheltering at home still allowed us to go to the supermarket and go to the pharmacy and go for a walk or a run in the park every day. If you are contagious, you can't do any of that. I'm sorry, you can't. Quarantining means you can't leave except for a medical necessity. And I know that's tough, guys. I know it's very tough to do. And you might not have realized how stringent this is. But we have systems to support you to bring food to your door if you don't have a solution. You can't go out for the food. So we'll bring it to your door. We have a way to get you prescriptions if you can't do it. We have a way to walk your dog if it comes to that, to deal with your laundry if you need help on that. We can offer a lot, but you got to play along. You got to quarantine. This is how we can reduce the chain of infection. Otherwise, contagious people are going to be walking around town, potentially spreading the infection. So it's important that community board leaders are part of this call. All of you, I think, by virtue of the fact that you've come to participate, probably are leaders in the neighborhood. We need you to be ambassadors to talk about this, just like you have done for the census. Every single community meeting I've gone to for months has talked about the census. Thank goodness we need that. The stakes are very high. the stakes are no less high for contact tracing and quarantining and isolating and testing. And so we need you to spread the word about this, to explain it, to explain that it's safe, that there are privacy protections, that there are anonymity protections, that there are support systems in place. So I am thrilled that CB8 has convened this discussion, and I'm happy to be part of it. And I don't know if I'm introducing Dr. Vora, if I'm passing it back to you, Dr. Fullilove, or Madam Chair, but I'm going to wrap up now my opening remarks and look forward to the rest of the conversation. Thank you so much.
Thank you very much, Councilman Levine. Yeah, and it is basically my turn to basically introduce Dr. Neil Bora. Once again, we're trying to make sure that we make this as information-packed as possible. Dr. Bora, maybe you can begin by telling us something about your background, and then let us know what's the most important thing we should be doing. If I'm correct that you have a video to share, we're really anxious to see what you've got to tell us. Dr. Bora.
Thank you so much, Dr. Fullilove, and for CB8 for having me here today. My name is Neil. I'm a physician with the health department and with H&H. And I have the great privilege of overseeing the TRACE program for New York City. This is something that's deeply personal to me, and I'm going to tell you a little bit more about that. But I want to share with you about my background and what brought me to this place. I'm an internal medicine trained physician. I used to practice in the Washington Heights area. I did my residency up there. I still see patients in our TB clinic with the health department. I joined the field of public health around a decade ago when I joined the CDC through this program called the Epidemic Intelligence Service. So if you've seen the movie Contagion, Kate Winslet is an Epidemic Intelligence Service officer in that movie. I watched that movie the night it got released at 12:01 a.m. I was there watching it, and sadly, there is relevance to some of what we're facing right now with COVID in this pandemic situation. Just a little bit more about why I have perhaps been tapped for this role, though. So I've been doing public health for a number of years. I worked in West Africa during 2014. I oversaw the Ebola active monitoring program here in New York City in 2015. More people were monitored for Ebola in New York City than any other state in the country. And there was that was related to the high volume of travel from West Africa into New York City. In 2016, I was very involved in Zika. 2018 and 19, I worked on measles because we had the largest measles outbreak in the country since 1992 here in New York City, sadly. And then last year, I was also in the Democratic Republic of the Congo working on Ebola as well. So I've been doing this for a while. And like I was saying before, this is a deeply, deeply personal mission to me. And the reason I say this is that my father was born in India, and he had smallpox when he was a child. And it left a legacy with its scars on his face, sadly. And many other people around the world have been impacted by smallpox. Some of you might be aware, smallpox is one of the diseases that carries a fatality rate of 30%. So 1 out of 3 people can die from smallpox. And it was the work of contact tracers in the 1970s that led to the eradication of smallpox. That is a gift that keeps on giving because we do not have to worry about smallpox to this day from naturally occurring smallpox, I should say. And so, the reason I'm bringing this up is that it was contact tracers that had such an important role in eradicating smallpox. And I'm not saying that we're going to eradicate COVID, but what I am saying is that contact tracing is going to play a huge role in where we go with this pandemic going forward. And New Yorkers have done such an amazing job since March in physical distancing, in social distancing. New Yorkers heard that message and banded together while being told to physically separate from each other, yet we banded together to physically distance, and we brought that case count down from the thousands on a daily basis to now less than 500 on a daily basis. As Mr. Levine was saying, Councilmember Levine was saying that it was a little over 300 perhaps yesterday. And so there are still cases in New York City, but it was New Yorkers who got together, just like New Yorkers have banded together in the past for 9/11, for Hurricane Sandy. New Yorkers have done that again right now to physically distance. And that is also the type of attitude and effort that is necessary for us to succeed with contact tracing. So I'm going to share with you a few slides just to give you an overview of contact tracing, and then we're going to launch into a Q&A. So let me share my screen for one moment, please. Okay, this is just getting set up. My computer's freezing for a moment, so please bear with me. I'm sorry, tech issue. There we go. Do you see the screen, the slides? Okay, so thank you very much. Okay, so setting the scene a bit, right? Our goal through the Test and Trace Core, the overall program is called the Test and Trace Core, and I oversee one part of it. There's three parts that we're going to talk about. I oversee the tracing part of this. Our overall goal is to suppress COVID-19 through interrupting chains of transmission, right? Because one person can infect another person who can infect several people. And if we can interrupt those chains of transmission, we can slow down the spread, we can suppress COVID-19. And we're going to be conducting contact tracing at an unprecedented scale in recent history. And this is a tremendous opportunity to do something impactful when the world depends on public health. And when I say to do something impactful, that means all of us, not just people in the public health field, people in the medical field. This is New York City as a whole has to work together to make contact tracing successful. So I want to give you a little bit of a schematic to help explain how contact tracing would work. So let's imagine we have a hypothetical infectious disease with an R0 of 2. So again, I brought up that movie Contagion before, and Kate Winslet actually does a very good description of R0 in that movie. You can think of it like, generally speaking, what R0 refers to is the number of people who will get infected by the virus if one person who is infected with it exposes other people to the virus, right? So in this case, if we have an R0 of 2, that means one person is going to infect 2 people, then each of those newly infected people will infect 2 more people. So if you let this go on for 3 generations, you would have 15 cases of this infectious disease after 3 generations of transmission. So now let's imagine that there's some program that identifies cases and contacts, and I'm going to define those terms a little bit more specifically in a moment. But let's say there's a program that identifies cases and contacts and separates 50% of them away. So it's 50% effective, right? Because now you've reduced that R0 from 2 to 1, right? So each person is only infecting one other person. You've not completely eliminated transmission. You've gone down by 50%. But notice that after 3 generations of transmission, you have a total of 4 cases instead of 15. So you do not have to be 100% effective for contact tracing to work. It can be very effective even if it's less than 100% effective. So let me give you an overview of the Test and Trace Core with that background. There are 3 components to it. There's the testing, there's the tracing, and then there's the taking care part. And we're going to dive into each of those right now. Before I tell you, though, about each of those components, I want to tell you about our commitment. Number 1 is that we are committed to using a trauma-informed approach that builds trust and facilitates sharing. New Yorkers have been through a lot in the last 3 months. Many of you on this phone, Councilmember Levine mentioned this himself, that he was infected, and I imagine others on this line right now were sadly infected, or they know loved ones and friends and colleagues who were infected. Maybe some of you sadly have lost loved ones as well, for which I'm very sorry. So when we do our work, we are committed to using a trauma-informed approach because we have been traumatized. Every New Yorker, at minimum, has been affected by this outbreak. We commit to understanding and supporting the populations who may be at highest risk for COVID-19 and its complications. We commit to protecting and maintaining individual privacy and confidentiality. We commit to communicating clearly, professionally, and compassionately. We commit to ensuring that our engagement is respectful and informed by cultural humility, gender identity, and expression awareness. and understanding of health inequities. We commit to, we commit to providing services that are available to all New Yorkers, regardless of immigration status, language, or identities. And we commit to providing safe and equitable practices for our staff, including hiring staff from areas that have been hit the hardest by COVID. Also, one other commitment that you don't see here that I should mention is that we are not perfect right now. We started on June 1st. We are not perfect right now. And I sadly have to admit, but this is the reality, we will never be perfect. But what I can commit to is that we will always strive to do a better and better job. We will listen to our clients. We will listen to communities. We will listen to professionals and experts so that we can incorporate that feedback and do a better job over time. So let's go to the test component. Who should get tested? We are recommending that every New Yorker should receive COVID testing at this time, whether or not they have symptoms. And I want to be very clear that immigration status will not be asked when getting tested, and these services are not considered a public benefit under the public charge rule. We also recommend that some people get repeat testing, for example, if they exhibit signs or symptoms of COVID, or if they're concerned about a possible exposure, or if they work in a residential congregate setting, such as a shelter or a nursing home, or if they are visiting someone who is at highest risk for severe COVID-19, such as people aged more than 65 years or people who have severe underlying medical conditions. And for those of you in CV8, which I imagine is most of the audience today, here are examples of testing sites in or near CV8. So there's New York Presbyterian, Weill Cornell, there's City MDs, there's Forward Clinic, Lenox Hill, and you can see the rest of the listings right over here. So let's go into now some terminology, cases and context. I've mentioned this a little bit on this call so far. And a case is defined as anyone who has a positive laboratory confirmed result for COVID-19. That does not include people who have had an antibody test. An antibody test is not a diagnostic test for COVID. There are also probable cases. Probable cases are people who are contacts of someone who has COVID, but these people now also show symptoms. So they don't necessarily have to have been tested for COVID. We would still consider them a case by virtue of having symptoms and having been designated a contact of a COVID case. So who are contacts? Contacts, largely close contacts, fall into four groups. These are household members. These are intimate partners, people who provided care or other services in the home of a case of COVID, and people who spent 10 or more minutes within 6 feet of a person known to have COVID. Those are the four categories for what we consider a close contact of COVID. So when we reach out to cases and contacts, this slide shows some of the things that we cover. For both cases and contacts, we educate them about COVID and their diagnosis or their exposure. We monitor them every day for new or worsening illness for up to 14 days. We identify their contact. If they are a case, we identify their contacts so that we can then follow up with the contact. And when we identify those contacts by talking to the case, typically over the phone, we ask the case who those contacts are, and then we also get down the phone number of those contacts so that we can call the contacts too. We recommend isolation and quarantine because this is how we are going to break chains of transmission. By getting people isolated and quarantined, we can interrupt transmission in communities. And we're going to talk more about how we can do that isolation and quarantine. Specifically, though, one tool we have is that we offer hotels for people who cannot effectively separate in their homes. We screen people for basic needs such as food and medication delivery if they choose to stay in their home, and we're going to talk more about that. We let people know about the resources available to them. For example, people who are struggling with the stress, because this is very, very stressful. And we also inquire about intimate partner violence. And then we let people know when they can end their isolation and quarantine. So we ask that every New Yorker be ready to receive a call from us because we are automatically going to hear about people who test positive or anyone who tests positive. If they tell us about their contacts, we're going to call those contacts too. So we are asking New Yorkers to answer the phone. If you get a call that says a caller ID of NYC test or trace, or the number starts with the digits you see here, please pick up the phone. Check your voicemail. And when we call you, please answer the questions honestly and accurately. We understand it's scary, it's hard, but we cannot do our work unless we're working together to honestly and accurately share information. It's also important that you make sure that your healthcare provider has your correct phone number and address so that a contact tracer can reach you if you get tested for COVID and you test positive. Finally, if you think you were exposed to COVID, but you've not been called by the tracer program, the TRACE program, you can still get tested for COVID. And if you test positive, we'll automatically enroll you to the program. So like Councilmember Levine was saying, we have much more testing capacity than we did months ago. So please take advantage of that and get tested. So let's talk a little bit about the support services. During isolation and quarantine, it is difficult, right? Already New Yorkers have been physically distancing for months. And now if you test positive or you are a contact, we're going to ask you to isolate or quarantine respectively. And that means that we're asking you to separate from other people, to stay inside, separate from others so that we can interrupt those chains of transmission. That is stressful. First of all, it's stressful because you're being asked to separate from other people, so it's socially isolating. But it's also stressful because you're not able to work. You feel separated from other people, obviously. And so we offer support services to reduce the stress and anxiety of the experience. And that means that we offer hotels, we offer food and medication delivery, we offer other services as well, for example, for pets. And we want to do this because we care about individual New Yorkers. We care about the public. And so by helping people isolate and quarantine, we can help people safely separate from other people. And as a reminder, no one will be considered a public charge under immigration law for speaking with one of our tracers or for using any service provided by the Test and Trace Corps. So that's the end of my slide deck, and now I'm happy to take any questions. Thank you so much for your patience and your attention.
Dr. Vora, thank you very much. I have a number of questions that were prepared before, and I'd like to split them up between what I think we agreed upon were some of the critical issues we'd like to share with the audience, but also give audience members an opportunity to participate. I think one of the burning questions that people have is, okay, I have now been contacted. What are they going to ask me? What are the questions that are going to be posed? How much of my private life are people going to dig into when they start asking me where have I been and who have I been in contact with?
Okay. I understand the concerns, right? Like people rightfully want to protect their privacy, want to protect their confidentiality. And there's many reasons why someone would be fearful of talking to the government and to the TRACE program, and I fully understand that. So let's talk quickly about some of the questions that we're going to ask. We start by, first of all, confirming who we're talking to, right? That's the number one thing, because we want to be talking to the right person. And then we go into a series of questions. Some of the questions are about demographic information. It's really important for us to ask these questions. It might be surprising why we'd be asking about race, ethnicity, about sexual orientation, about gender identity. But the reason we ask this is that we know, not just for COVID, but for health conditions across New York City and around the country, sadly, that certain groups of people are disproportionately affected by bad health outcomes. And that is related to structural racism, by legacies of socioeconomic disparities, for a variety of reasons. And that is why we ask these questions, because by asking about demographic questions, we can better understand which groups of people in New York City are disproportionately affected, and we can therefore address health inequity. Another group of questions that we ask about are symptoms. It's really important. We are doing not just that initial interview, but we actually follow people over time, up to 14 days through the interaction, because we care about individuals, and we have seen too many New Yorkers over the last 3 months die, including dying in their homes. And that's why we're checking in on people, whether you're a case or a contact. We ask about the symptoms because we want to see if you're developing any alarming symptoms that would require referral to a provider. We also ask cases about who have you been in touch with, who have you been in close contact with while you could have been transmitting the virus to other people, right? And that falls into the 4 categories that I mentioned before about household mates, about intimate partners, about people who came into your home, and about people who you spent 10 or more minutes with within 6 feet of you. And then we find out the phone number and address for those close contacts so we can follow up with those people, right? And finally, we ask about the need for wraparound services because we want to make sure that we make it as easy as possible for people to safely separate from other people, whether they choose to separate in hotels or in their home. It is our obligation, it is our mission to provide services to allow people to safely separate from others if they are a case or a contact.
And Neil, if I may, forgive me if you mentioned this, but it's so important, it would even be worth repeating. You are not going to share the name of a person who has tested positive with someone who may have been exposed so that privacy is protected. You'll call a contact and you'll say, or someone who may have been exposed, and you'll say that we have information that you've been in close sustained contact with someone who has coronavirus, but you will not share the name. That's correct, no?
That is correct. Thank you for bringing that up. Let's talk a little bit about our commitment to data security and to privacy. We can only function if the public trusts us. And if we lose that trust, then we're going to impair our ability to stop the virus and to take care of New Yorkers. And part of that means that when we identify, when a case tells us about their contacts, when we follow up with those contacts, we're not going to name who the case is, name those contacts, because we want to preserve that privacy for that case, because we want the case to be honest with us. We want that person to tell us who they've been in touch with so that we can inform other people who are contacts that, hey, you've been exposed, please go get tested, and we also want you to start quarantining, right? So that's one aspect of the data privacy and the security that we take very seriously. But also, we are going to protect these data that we get to the fullest extent of the law. We understand why people might have concerns about sharing data with us, and we do not want to release this in any way. So that is why we make sure that our technology is secure, that we have like credentialing processes so that we can limit the amount of people who have access to data, and we do not want to be disclosing inappropriately any of these data. I'm also just going to add a little bit more on that, which is when we call people, we ask them about their name, we confirm the name, we know the name of the people. So we ask like, okay, are we speaking to Mark Levine, right? We confirm that name, and then we ask for your date of birth, but we're not going to ask about social security number, or we're not going to ask about bank information or your credit card number or anything like that. So if you're getting a call like that, then it is a scam if they're asking for your financial information or your social security number.
Very good. One of the questions I think that is on everyone's mind is, listen, if I go to get tested at one of the places that you listed, is that going to cost me money? Is that going to be something that is going to drain whatever support I'm getting from my health insurance? Is it going to be a cost that's carried by me, or is it something that's going to be passed on to the city?
I'm so happy that now there is so much more access to testing than there were months ago. Again, as Councilmember Levine had mentioned before, that we are able to get New Yorkers tested, and we want every New Yorker getting tested, and it is free. You can go to the New York City Health and Hospitals website to find out where to get tested, because there's a lot of test sites that we list there. You can call 311 to find out test sites nearby you. I also presented some of the test sites that you can find in CV8. So there is free and easy testing now available in New York City, and please take advantage of those resources to get tested. Every New Yorker should be getting tested at this time. Some New Yorkers should also be getting repeat testing. If you are worried that you were exposed to the virus, wait a few days, for example, wait 5 days, and then just go get tested. And that way you can find out if you have the virus or not. Don't wait for us to call you. Just go ahead and get tested if you're worried about it. Also, I'll say though, if you're worried that you were exposed and you're going to wait a few days before you go get tested, again, sometimes waiting around 4 to 5 days is a good thing if you're worried about a specific exposure. So you wait those few days, but if you start having symptoms, get tested immediately. But make sure you also start separating yourself from other people as soon as you start having any symptoms such as cough or fever or shortness of breath, because those are all symptoms of COVID.
So when I'm home and I'm now being isolated and I'm depending on the many services that you described to help me with getting fed, getting medications, what have you, um, is it the case that I can trust the people who are providing those services? I mean, doesn't it mean I have to let strangers into my home? What assurances have I got that if I am in some kind of isolated setting that I can trust the people who got to provide me with all the services that I would need to just to stay around?
So it's our priority to be able to deliver services to New Yorkers who choose to stay in their home. We are not forcing New Yorkers out of their home and into hotels or any other setting. This is a voluntary program. We hope that New Yorkers choose to take part in this and isolate and quarantine as we're recommending, and we're offering a lot of services. And the sad reality is that the New Yorkers who have the hardest time safely separating from other people in their homes are the New Yorkers who are in most need of those support services that we can provide through the program, right? And we want to make sure that we can get those New Yorkers those services, and we need to make sure that they trust us that when we give them those services, we're not violating their privacy or any of their other rights. And so when we, as our tracers, speak to cases and contacts on a daily basis, we ask those people, do you need any essential services such as food or medication delivery, or do you need help for mental health resources? Do you have intimate partner violence concerns? We are asking these questions, sometimes specifically, sometimes very generally, but we have resource navigators who are there to help deliver these services to the home. If people choose to go to hotels, they get them delivered at hotels. And another thing is that we cannot do our work without the trust of community. And that's why we've also started partnering with community-based organizations, so that those community-based organizations can help us get those resources delivered to people in a way that keeps the community at the forefront of all of our considerations.
Very good. There has been a noted and well-reported rise in intimate partner violence. So you're going to be asking people about those issues. What happens if someone says, yeah, this is really an issue with me? What happens then? There's some concern, for example, that would this mean that the police would be involved? Does this mean that ICE would be involved? I mean, if you've got two problems here, number one, someone's been exposed, but they're also saying, I've got real problems isolating here because of intimate partner violence. Now that you have the information, what do you do with it?
Sadly, there have been reports that intimate partner violence is on the rise around the country, related or with overlapping at the same period of time as COVID. And there might be several factors that have contributed to that. First of all, that people have been forced to stay inside. And so there's more opportunities in some instances for that type of violence to occur. And also the stress of the situation. So there's many variety of different reasons that have contributed to this rise in intimate partner violence. And this is a major concern. And so we have resource navigators that can help connect people to the resources they need. Certainly, if it's an emergency, any of our clients, if it's an emergency, should call 911 at any time. If they're worried immediately about their well-being, about their life, that is always an option. But our job is not to report people to law enforcement. Our job is not to report people to ICE or anything like that. We are here for public health and to give New Yorkers information and to provide people the services they need to stay healthy. And that is our mission.
One of the other questions that comes from the audience has to do with what happens if you're in a setting where multiple people are reported to be infected with COVID-19, but we test them at different points in time. But the one thing that happens is multiple people name me as somebody who's been in contact. That means that I could be in quarantine forever. Each new name, does that require that I now have another 14 days? It at this point would seem to be almost like a prison sentence. What happens when you're named multiple times on a contact list? Is that something that is going to really require folks to be isolated for a long, long time?
So there is a standard amount of time that people are at risk for getting COVID after an exposure, and that is 14 days. That's what the science shows right now. So that's called the incubation period. And so if I were exposed today, right now and I were to go under quarantine, I'd have to wait 14 days before I'm released from that quarantine. Okay. And when I say quarantine, that means the separation of yourself from other people, right? While you're watching yourself to see if you develop symptoms. Okay. Now, if I get exposed multiple times, if those multiple exposures all overlap in the same 14-day period, then we're not going to add up, we're not going to stack the 14 days on top of each other. But if I get exposed today and I undergo my 14-day quarantine period, and then the day I'm released, I get exposed again, then you might have to re-undergo the quarantine because you've just been newly exposed again, right? So that is a concern. But that's why New Yorkers need to take this very seriously. We have been through so much over the last several months, and now we're reopening again. And Councilmember Levine mentioned that there's a third way possible, right? That we're doing the slow phase approach to reopening New York City. And that's really important. And contact tracing is one of the ways that we can help make sure that we stay on track for reopening New York City. And so the more we adhere to the contact tracing recommendation, where if you are sick with COVID, you've been tested as positive, that you stay at home for the amount of time that you're told to stay at home, then we're going to prevent people getting exposed every time New Yorkers leave their home. Same thing goes if you are a contact. That if you are a contact and you're told to quarantine for 14 days, don't leave your home. Use the services we offer you so that you get what you need to stay in your home for those 14 days, or use the hotel that we offer. But that's how we can break those chains of transmission, because even if you're feeling well but you've been exposed, you could be transmitting the virus. This is a scary virus. It's a different virus than Ebola. I've done a lot of work with Ebola in West Africa, in Central Africa, in New York City, in Atlanta. And Ebola is a different virus, but this virus scares me in ways that Ebola doesn't, because this virus can be transmitted even when you don't have symptoms. And that's why when you've been exposed and you're feeling well, but we tell you to stay home, please stay home. That's how we can avoid exposing other people.
Very well said. Now, this is just between us. I'm frequently a person who says that New Yorkers all have a PhD in mind your own business. How's this going as a program? I mean, what's your own sense of its success? I'm thinking that the average New Yorker said, I don't think so. And it must be a very, very difficult sell to folk who are very proud of the fact that, I'm just with everybody else. Don't come bother me. I'm wondering whether or not, in the passion that you express for doing this, it's also being returned by New Yorkers who are saying, yeah, this is my civic duty. I should be doing this. What's your own sense? Are we succeeding? Is it an uphill battle? What do you think?
Thank you for that question, because I have a lot of thoughts on it. First thing I'd say is that New Yorkers are amazing at getting together and responding to emergencies. We've seen that in 9/11, Hurricane Sandy, with COVID. During the past several months, New Yorkers are the ones who are responsible for bringing this outbreak down and to the current low levels of transmission that we have, or the lower levels that we have. We still have it, but New Yorkers were the ones who did that work to get us where we are right now. And so I have full confidence that New Yorkers will hear this message and will make the right choice to participate in the TRACE program so that we can keep fighting this virus and keep it suppressed so that we can reopen New York City and get back to doing what we love and save other New Yorkers' lives. That's number one. Number two is that you asked, how is this program going? And I'm going to repeat what I said before. We are not perfect right now. We're never going to be perfect. But what I can commit to doing is that we are going to listen to communities. We are going to listen to experts. We're going to listen to our clients. And we're going to continually try to get better and better, right? This is going to be an evolution, and it's going to get better over time. And I've already seen progress from June 1st up until now, and I expect to keep seeing that type of progress. Number three, empathy. For me, like there's the science, but the biggest indicator of how well we are going to be, how well our team is going to do, is the empathy that the tracers show, right? And I've met like, this is hard. We have brought in thousands of tracers, most of whom I've not met. I'm never going to meet them, but I've had the opportunity to meet a few in person and to get on the phone with a few of them. And these are amazing New Yorkers, and they show so much empathy, and they care so much about what they're doing that it gives me a lot of hope for the work that's going to be done. And many of these New Yorkers come from the very communities that have been hardest hit by COVID. And that is so important, that our team largely reflects the communities that they're working with. Because the only way for this to work is for communities to trust us so that we can work together to overcome COVID.
Of all the questions that you get asked or that contact tracers get asked, what would you describe as the most difficult and the most challenging? I mean, I've been very, very clear that you've tried to cover a lot of bases, and you're very, very aware of all the fears that people have about what this really involves. But I'm wondering, is there one issue that you really worry about most as being the thing that you hear most often, that is the hardest of all the barriers to break?
I think that it depends from person to person, right? We've all been affected by COVID in different ways. We all have our different backgrounds that brings us to this point in time. We know that COVID has disproportionately affected people of color, people of lower socioeconomic status, disadvantaged communities. And so we're all going to come in at this with different concerns. So I just want to be very clear, though, that for us, we want to hear from you, and we want to establish that rapport, and we want to make sure that New Yorkers understand that we're here to help you all take care. Right? That's why we offer the services. That's why we prioritize data security and confidentiality. That's why we understand that we have a great responsibility, and it is a privilege to be doing this work. Like, to me, like, to have this type of role is one of the greatest privileges of my life. And the rest of my team, I know how seriously we take this role. And that means that we have to answer those questions that we get and allay concerns, and we have to learn and grow as we get these different questions. And so I think there's a huge range of different concerns that people bring with them for understandable reasons. And we have, as a team, have to understand that each person in the program is an individual, each client that we're working with, and that we need to tailor our services to them to the best extent possible.
Excellent. I think we're very, very fortunate as a city to have you in charge. Councilman Levine, this is supposed to go to 7:50. It's 7:49. I always want to make sure that as our elected official, that you have a shot at either a last comment or a last question. Je vous en prie.
Merci beaucoup. Well, Neil's been great. And the facts that you've shared, we need to ask the public to disseminate. We've had a few dozen activists and leaders on the call tonight. And our ask is that you go forward and you talk to the people who turn to you for guidance about what this program is, about the protections built in, about the supports built in, and most importantly, that this fight is not over. And we just can't afford to stop doing the hard work of social distancing and wearing a mask and hand washing. Those things tend to still get a lot of play on Twitter and elsewhere, but you have to add to the list, take part in contact tracing, answer the call when it comes in, be part of this program to protect your family and your community and the people in your workplace and the people of the city. This is how we are going to contain this horrible virus, suppress its spread while we achieve the goal we all desire of reopening. So I'm really grateful to you, Dr. Fullilove, for moderating, to Dr. Vora for sharing really smart updates, and of course, Alida and CB8 for modeling what community boards should be doing to get the facts out, to answer questions, to alleviate fears. I'm gonna put my email in the chat so that if any folks have questions to follow up with me or my office, don't hesitate to reach out. we're here for the long fight ahead. Thank you so much.
And Dr. Vora, there are many questions that I didn't get to, and some of them are rather detailed, some of them are rather technical. They're excellent questions. I think because we only had a limited amount of time, folks who have questions, how should they address them to you? Is there some site where the kinds of issues that people raise where there's some potential for answer, or maybe even somebody to answer them?
Yeah, so I'll send, after this, if I could just send you all the website where we have some frequently asked questions, and we want to make sure that we hear people's questions and concerns. And so again, this is why I appreciate these opportunities to exchange with you all. So I want to make sure that like we hear these questions and learn what concerns are so we can better address them. So I definitely want to hear these questions. Maybe Alita can share those with me afterwards.
Alita, I think this is all on you now. Thank you very much. I have very much appreciated this. Dr. Vora, very, very well done. I think your answers were really quite excellent, quite clear. I'm glad that you're in charge. I'm looking forward to great things from you because God knows we need it. Alita?
Thank you. Ditto that, for sure. You've all given us a great deal of information to think about. I hope we have convinced the members of our audience to participate in the testing and the tracing program. New York has been a leader in flattening the curve. Let's be leaders in keeping it flat. Stay tuned for part 2 on July 6th. There have been lots of additional questions, as Dr. Fullilove has pointed out. We want this program to succeed. So there is a working group planning this. I'm going to be talking to the working group about perhaps doing a part 2 of this particular type of program to address all of the questions that have been unanswered. And by that point on July 6th, the program will have been underway for over a month, and we may see issues such as barriers or confusion that prevent people from participating fully. We're also concerned about other issues such as privacy and technology and want to make some recommendations, if appropriate, to the city. So follow our website and we'll be sending out emails, but July 6th is the date to look for. Thank you so much, Councilmember Levine, Dr. Vora, and Dr. Fullilove for a most engaging evening. It was really terrific. You guys are just super. Thank you so much. And we'll see you all soon.
Thanks. Be
Good
safe,
night.
everybody.
Thank you.